Today's the 12th anniversary of Bell Let's Talk Day, raising funds and awareness for mental health initiatives by donating a nickel from every call, text, or social media interaction over the Bell network for the day. Here with more from one of the benefactors and one of the country's top mental health and recovery institutions is Dr. David Gratzer from CAMH, the Center for Addiction and Mental Health. Doctor, thanks for being here.
Thank you for having me.
You know, even as societal stigmas surrounding mental health are getting less oxygen these days and over the years, people still have a tough time, right? It's culturally baked in for many to feel shame. People get infantilized all the time about mental health and addiction issues. You know, don't talk about it, push it down, just, you know, suck it up, get through it, carry on, that sort of thing. That is a tough knot to untie. So walk us through the work you do at CAMH as the attending psychiatrist.
First things first, I think you've hit the nail on the head, to use that old expression. Stigma is so much better than it's been in the past, but there's still so much stigma. We have a lot of work to do. What do I do in my work at the Center for Addiction and Mental Health? I see people with all sorts of problems, mental health problems in all walks of life, and I work to try and get them better.
And addiction specifically, it's a progressive illness. It's important to distinguish, isn't it, between people who may, you know, overindulge with alcohol or substances versus an addict who, you know, simply can't choose to put it down as easily.
Well, our thinking has really shifted on substance in a short period of time. As you know, we used to look at this as some sort of a moral failing. In other words, you drink because you're just not a strong person. Actually, we find there's a tremendous genetic tie, meaning that if your grandfather had such a problem, your father had a problem like this, you are at a high risk of a problem like this. But, you know, to get to your point, this goes beyond, I had an extra glass of wine with dinner at a birthday party. We're talking about when it interferes with day-to-day functioning. I love my job, but I'm so hungover in the morning, I can't get to work. And that's when we think taking a step forward and talking to your healthcare provider can be transformative and change your life.
Let's talk about isolation, doctor. It's become a paradox during this pandemic, right? The best way to beat the virus, but a terrible way to manage your mental hygiene. And even well before COVID, it was often the default reaction to confronting, you know, mental health issues. How important is it for us to reach out? You know, they say recovery is an inside job, but you can't do it alone.
I think connecting with people is always important, whether or not you have a mental health problem. I mean, we're just wired to like to connect with people. There's a short little paper by Diamond in the British Journal of Psychiatry talking about ways to improve your mental health. Number one on that list was connect. So you can't pop over at your neighbor's necessarily and grab a cup of coffee in his kitchen, but we can be creative. We can use FaceTime or WeChat. Right. Heck, we could even write a letter if you're old-fashioned. But the point is, even though we're not going to restaurants and bars right now, we can still reach out and connect with people. And if we've got a problem, it's important to talk to our friends and our neighbors and ask for their help too.
And on the other side of this coin, doctor, let's also speak about the importance of routine and scheduling self-care and solitude, which, unlike isolation, can be restorative, right, as kind of an insurance policy against fatigue and stress and depression and even addiction.
Look, we're all a little bit knocked off our routine to pick the first thing on your list. I was talking to a patient about going to work, and he talked about how he used to get up and catch the subway and go downtown. Well, he doesn't work from his downtown office anymore. So what's a person to do? Well, studies suggest actually if you maintain your routine, you get up at the same time, you get dressed for work, even though you're not going into work. Maybe you don't walk to the subway, but you still go for a morning walk. These sorts of things are really helpful. We're all off our game, but some routine and regularity, including, by the way, about sleep, can make a real difference.
That's such an important piece. You know, clearly, doctor, in your work, there's no one-size-fits-all solution, an on-demand way to deal with, you know, patients. Where does the scholarship and the academia end, and then the construct of a you know, singular patient's diagnosis with talking and listening?
Well, we have better and better work done in mental health care. I mean, the field has grown so much more sophisticated. There's never been a better time to access care and get the help you need. On the other hand, it's important to remember what's in the studies, what helps people. And the patient sitting before me, perhaps, is a person. And so we need a customized plan, right? So somebody who's chronic pain issues isn't able to exercise, which, by the way, has good antidepressant qualities, the way somebody who's young and physically healthy might. But again, what I'd emphasize today, is that there's a lot of hope. If you think you have a mental health problem, reach out to your family doctor, because treatments for depression and alcohol use disorder, these things are so much better and more sophisticated than even 20 or 10 years ago.
Dr. David Gratzer, you are the attending psychiatrist at CAMH, one of the great institutions in this country and around the world, and a very illuminating conversation. Thank you so much, and have a great day.
Thank you, sir.